What is the QT mini facelift? This is a question heard very commonly at our practice here at Premier Image Cosmetic and Laser Surgery. So I'm going to tell you some of the nuances of what is a mini facelift, or our QT mini facelift. For one, who's a candidate for the QT mini facelift? One, the patient who just wants a refreshing, rejuvenated look to the face. Two, someone who can't give or doesn't want the associated recovery time with a larger procedure. Three, someone who just doesn't need a full facelift. And that's really where it came about. The second question I hear about the QT mini facelift is, what does that mean? QT lift, where did that come from? One, it means quick transformation. Two, quick recovery time. And then three, it's on the QT. Not everybody has to know you had it done. The name QT mini facelift tells you a lot about the lift itself, mini facelift. It truly is a scaled down version of a traditional facelift. That is really how it was born in our practice. It came about from patients really who didn't want a full facelift, didn't need a full facelift, or just didn't have the time to give for the recovery of a traditional facelift. So what's involved with it? Small incisions around the ear, probably about a third in comparison to a full facelift. But that is where the differences end. Underneath the skin, you get all the advantages and lifting power of a full facelift, in that we tighten what's called the muscle layer of the face. This is called the SMAS, or the SMAS of the face. This area is tightened with sutures underneath the skin, and that is what gives the mini lift its longevity and lifting power fairly similar to a full facelift. So what are the advantages to a mini facelift? A, quick recovery times of about 3 to 5 days in most instances. B, we can couple it with other procedures. Commonly we will do a eyelid lift with it, or chin augmentation, or possibly some fillers at the same time as the mini lift. And the obvious things, less recovery time, less bruising involved with the mini facelift, and sometimes we can even do this under some local anesthesia with the patient permitting, as far as being able to handle something like that. We've done this in the past and it works very, very well for a lot of patients.